I invite Dr. Manoj Kumar N, Vice Principal, VPSV College, Kottakal.
Okay, the last hour begins. In a college, 3 to 4 hour is somewhat boring. So, today it is my duty to handle the time. So, what I am telling is the real life scenario. യാഥാർത്ഥ്യം എപ്പോഴും അവസാനമായിരിക്കും അറിയുന്നത്. The real life scenario I am telling because we are the part of Pharmacovigilance Center even from the beginning of the revamping era, early 2018. So we know the obstacles, what is the problems, what are the things behind the curtain, the word used by the Galib sir. So some of the aspects we will discuss within 30 to 40 minutes time. I will not take more than 45 minutes. So we are always telling about something related to the quality, isn't it so? The three pillars are there in a medical system. Already we know quality, safety, and efficacy. Out of which every system can survive for a longer duration of period. That's why our system survived for the last thousands of years due to the quality. Because related with the quality aspects, we are studying in the first chapter of Ashtangridayam itself. Chigilsidasya nirdishtam pratyegam ta chadurgunam. We need some qualities for the pada chadushtayam, for the safe and effective management of a disease. So that's the first and foremost pillar we want to discuss about. But nowadays we are little bit confused. Our system is secondary to the people. Even though our system is not there, nothing will happen. That we know. Number two, they are taking the Ayurvedic medicines combined with other medicines. Even I think all of us can get at least 1 or 2 phone calls every day. Phone calls, not even consultation. I am taking so and so allopathic medicines. Sir, you please prescribe one medicine along with these other things. This is one scenario that we are facing every day. So, this is a kind of practice that people are doing, mixing other drugs. So, as far as the drug scenario is concerned, a lot of things are there. We are not going to that scenario. Then, a lot of OTC products are being consumed every day. Over-the-counter products. They are buying and consuming without knowing the dose. Already being told by the Acharya, Dushyam Desham, Pellam Kalam, all those things. Sukshma Samikshesham. Even though I am giving with all these precautions, then too something happening. Some adverse events, adverse reactions. Some things which is not we are expecting is happening. Why and how? That is a basic thread of pharmacovigilance. That's why it has become a science. That's why it has become an activity. Activity of all the spectrum of people. That means with Vaidyan, with drug, with Upasthada and Rogi. We need all kind of cooperation even from the Upasthada and the Rogi for the proper implementation of the process. That's the key thing you have to keep in mind. So, this is a quality related activity. We need attention and we need cooperation from all sources. So, from implementation to impact, that's a topic given to me. So, it is about my institution. I am from the Kottakal Ayurveda College. All of you may know that. We have started the peripheral center in 2018 October after the meeting in New Delhi, All India Institute of Ayurveda in 2018 January, where some around 60 centers selected for the peripheral center, and it was only the one center from Kerala. And we have started from 2018 October onwards our journey. From that time itself, Dr. Asina is the JRF, and I'm doing the coordination process with the help of all the other faculties. Even though we are doing as a labeling, we will do the activity with the help of all the faculties. Dr. Nasima is there, one another faculty from our college. With the help of all the other faculties and students, interns, PG students, we are doing the activity. So we need a concrete help from all the sources. That you will have to keep in mind. It is not your duty. It is a complex mechanism. So this is all these things, it is the OGO system, Ayush, Aushadhi, Gunavatta Evam, Utpadan, Samardhan Yojana, coming under national program, focus on the safety aspects and the surveillance of advertisements. For the last couple of years, we are mainly focusing on the misleading advertisements. So that's why Gallup sir told they got around 48,000 of advertisements, misleading advertisements. Even though these things are known to the people, then too they are taking the medicines from the counter and consuming. The other most important thing that we noticed that for the last couple of years, we are not getting advertisements in a vulgar way. ഒരാഴ്ച കൊണ്ട് 10 കിലോ കുറയ്ക്കാം, ഒരാഴ്ച കൊണ്ട് സുന്ദരനാവാം, ഇത്തരം പരസ്യങ്ങളിപ്പോൾ ഒരു പരിധി വരെ കുറഞ്ഞിട്ടുണ്ട്. അതൊരു പക്ഷേ നമ്മുടെ ഫാർമക്കോ വിജിലൻസ് ആക്ടിവിറ്റിയുടെ ഒരു ഭാഗം ആയിരിക്കാം എന്നാണ് നമ്മൾ കരുതുന്നത്. ഇതിനു മുമ്പ് അങ്ങനെ ആയിരുന്നില്ല. ഇത്തരം പരസ്യങ്ങൾ ധാരാളമായിട്ട് നിങ്ങൾ കണ്ടിട്ടുണ്ടാവും. എപ്പോഴും ഇതൊക്കെ ഒരു നമ്മുടെ ഈ പുവർ ഇംപ്ലിമെൻറ്റേഷൻ ഓഫ് റെഗുലേറ്ററി കൺട്രോൾസ്, അതാണ് നമ്മളുടെ ഇത്തരം ആക്ടിവിറ്റിയെ പിന്നോട്ട് നയിക്കുന്ന ഒരു പാഠം. എപ്പോഴും ഇത് ഒരു മോഡേൺ ലാംഗ്വേജിൽ മോഡേൺ സിസ്റ്റം പറയുന്ന രീതിയിൽ വരുമ്പോഴാണ് ഇതിന് അംഗീകാരം കിട്ടുന്നത്. We are saying something related with the walking. After the meals, you may walk around 10 minutes. Hundreds of calories may burn. It may be useful in the pre-diabetic and diabetic patients. It is already mentioned in the science. Adhana chatrapaditra rahido munivartana yojananam shatamiyayal. But it is not observed. But it is saying in the modern way, someone is looking. So the poor implementation of regulatory control was the key factor behind the failure of this particular scenario. So based on these aspects, the authorities has noticed that the advertisement is also plays an important role in the misleading. Advertisements also plays an important role in the adverse drug reaction, maybe some undesired reactions or something like that. So mainly we are now focusing on the advertisements also. Yeah, about our PPVC established in 2018. Mainly we are doing these sort of things, documenting and monitoring and reporting and awareness, because as far as the reporting, documenting and monitoring is concerned, it is a part of the duty, but the awareness activities also plays an important role. ബോധ്യം ഇത് എല്ലാവർക്കും ഉണ്ടാക്കി കൊടുക്കുക എന്നുള്ളത് കൂടി നമ്മളുടെ ഒരു കടമയാണ്. അതുകൊണ്ടാണ് ഇവിടെ മുന്നിൽ പറഞ്ഞ എല്ലാവരും ഒരു വോളണ്ടറി ഇൻവോൾവ്മെൻറ്റ്, വോളണ്ടറി ആക്ടിവിറ്റീസ് നീഡഡ് from your part, from our part, from the whole institution in order to progress, in order to improve the system. So this may be the three aspects based on which every PPVC can work: documenting and monitoring, reporting and awareness. That we can do. In every institution we can do this sort of activity. That's easy. And we can do at least one or two awareness activity to the interns. Every batch of interns come, you may give an awareness class. That we are doing every 2 to 3 times in a year. Every PG batch. Now it is no issues because it is a part of the PG curriculum. No issues, it is coming under the syllabus. It is also coming under the NCSM curriculum as far as the UG syllabus is also concerned. No issues from 2021 onwards. 2021 BAMS admission onwards, it is a part of the BAMS curriculum. So there is no such issues now. then what we need is a kind of infrastructure. At least we need a room with a computer, with a manpower. Everything is needed for that because everyone knows all these things. But as far as institutional pharmacovigilance is concerned, something is needed. That's why I'm telling this whole thing. Then the resources, a dedicated team of professionals. Because in every aspect we need a professional and continuous approach. For the victory of everything, we need a professional approach and a continuous approach. Satata Adhyayanam. That's the continuation process mentioned in other aspect in Ayurveda. So it is a satata process. You may do the activity continuously without the break. Have a break, have a Kit Kat, no. You may continue the process. So that's the key thing. So resources means a dedicated team of professionals, including coordinator and research staff, is required to manage the program. Apart from these two fellows, we need a concrete support from all the faculty members, PG students, UG students, and office staff. Everything is needed. Then only it will become a successful story. What are the real world challenges? Already mentioned in a couple of classes before also. Lack of awareness among practitioners, limited reporting system and infrastructure, complexity of polyherbal formulations. That's also very important. We know that there is some complexity in our formulations, yogam. Then when we get a chance to present a class in a TV show or in a radio show, you are telling, you can use Yuvashadi Vadagam, you can use Haridra Khandam, you can use Tali Sapatradi Vadagam, you can use Indugantam Kashayam for 3 months. Don't do that. Because by hearing your reports, by hearing your class, someone may take. Because we know that Tali Sapatradi Vadagam, Tali Sapatradi Churnam, Yuvashadi Vadagam, Haridra Khandam, everything works on the aspects of Kandyam. But there may be some differences. There may be something, maybe Vadakapa Samagam, there may be Kabha Nisaragam, there may be some other aspects also. According to that, the action may vary. So, don't give such kind of classes in a public platform, mentioning the names of the yogas. That's very, very important. When you hear a talk of a homeo physician or an allopathy physician, they don't tell. Go for a homeo graduate and take the medicine. They will tell that level only. In the modern medicine, they will not tell the medicines. There are certain medicines you can use with the help of a medical practitioner or a Vidagdhan. Something like that they will tell. But when we get a chance, we will tell. You can use this sort of things, that sort of things. It is not good. That is also a chance for irrational use. And improper manufacture is other thing that is there. A lot of process is needed for some drugs, like the Shodhana procedures, we know. Without proper Shodhana, they are adding the medicines. We are teaching Shodhanam, Karma Vijnayam, Dravya Dosha Nivaranam, we know. But without proper Shodhana, they are adding something to the yogam and resulting in some bad results. So, this is also a key area we'll have to focus on. And an idea, complete idea about our Samhitas and Nikhandus. For our clarity, that's also very important. For example, when you are telling about Aragodham and Haridra in a skin related spectrum, Aragodham is mentioned as Kaphapitta Shodhanam. So there may be an element of Shodhanam in that. But as far as Haridra is concerned, it is a Shamanam, Rasayanam. That kind of element is there. But difference is there. But we are giving some prescription combining Aragodha Soam plus Haridra Gandam or something like that, mentioned by Rajagopal sir in the morning. So, before prescribing a medicine, a complete and concrete understanding or for samhitas and nikhandus is very crucial. At least an Ayurvedic knowledge, a concrete Ayurvedic knowledge, not a vague idea. That's our duty. That's it. That we want to tell our students. You must focus on these sort of things. You must clear these sort of things. Then only you can give some prescriptions. Otherwise, you will get, because when we get some prescription from, mainly from a registered medical practitioners, we are in a dilemma. There may be Mahatikta Kashayam, along with Sangabhasmam will be there, along with Ashtachurnam will be there, along with other Palasachara and all those things will be there. What is the logic? Where is the yukti of that prescription? So, the irrational prescription is one and important cause of these sort of things. For that, we need a concrete idea about our Shastram in a better way. So, we'll have to teach, we'll have to tell our students in that manner also. Go to the key points, go to the down, what is telling by the Acharya, and think about, try with your own yukti and all those things is very much needed. So, this may be the real world implementation challenges. All of us know these sort of things. Hesitation in ADR reporting may be, fear of damaging, always already told by many of the talkers, lack of familiarity with pharmacovigilance process, perception that ADRs are rare in Ayush systems, already told by, concerns about the legal or regulatory consequences. All these things are there. So, for that purposes, from 2018 onwards, we are working on it for some kind of awareness. So, we are conducting this sort of awareness classes to the interns, the PG scholars from 18 onwards, and we are conducting national seminars, annual seminars for the entire community. And we are giving, every month we are sending emails to the DMOs of ISM. Sir, we are doing this sort of activity in Kottakal Ayurveda College as Peripheral Pharmacovigilance Center. If something is happening in your premises, in your district, tell this fact to the medical officers. So far we didn't get anything. Already we are sending to the DMOs, not to the, you are a DMO? Yes. We are telling, already intimated multiple times to DMO. DMOs of Kerala all together, all 40. And some of the DMOs called me also, something is came. It is there in the computer, like this. Okay. The first national seminar we conducted in 2021 by the reputed personalities from Tanuja Nesari Madam, Galip Sir, B.S. Prasad Sir, T.S. Muralidharan Sir, the named as Agni Vrat, based on the basic principles. As far as the implementation factors is concerned, the current status, everything counted on this. It was conducted in 2021, 4+ years back. It was a success. Galip Sir came there, Basad Sir, all those fellows came there and gave a nice discussion. After that, and in our campus, there was an awareness among students. Something is going on in our campus is there in Kottakal. So, the national webinar, it was a webinar in 2022 due to the maybe some other aspects. It was a webinar because something is done in that aspects also, 22. Then 23 also we have conducted by the nearby Pharmacology Department of MAS Medical College. Along with that also we have conducted something, taking some other aspects of pharmacovigilance. And 24 also we are conducted as far as the Panchakarma aspect of pharmacovigilance in Panchakarma. Because we know that the Panchakarma treatment is reducing the pro-inflammatory markers and all those papers are there in the surroundings. Then too something is happening. Already told by Rajamohan Sir, Anarhar and Arhar is there. Dose is there, time is there. All these things are there, and then pharmacovigilance aspects in Panchakarma. And this year we want to conduct a seminar based on the Shalakya or Shalya related spectrum. We are planning in the next month. So, these sort of aspects will be, you will get in your institution also. You may concentrate on these sort of aspects. Try to conduct at least 1 or 2 in your institution. with the help of other faculties of your college. There will be no such problems. Then public awareness programs already we can say very crucial in this aspect because it's a combined activity. Promote reporting is very essential, already told by all the speakers. Then awareness programs also we have conducted multiple times. Workshops for healthcare professionals conducted in 21. Public awareness campaigns multiple times. The collaboration with universities, in other universities also we have conducted 1 or 2 times. Then some pictures, it is only some pictures regarding the awareness activity. It was during the COVID pandemic. That's why you can see the mask and all those things. Then focus on patient safety, expansion of reach and developing resources. These are the key areas that we want to focus. Every center will have to focus on these 3 areas. Focus on patient safety. Safety clinical monitoring is the fundamental aspect of pharmacovigilance. Already told by the speakers. Because patient safety, patient first. That's the important thing. Expansion to reach, you'll have to reach to other people also. Developing resources. Resource development is also very important. You can buy some online books or other books and conduct some other activities. The computer is needed and everything is needed. For that we need some funds also that you'll have to allocate from your institution. That is some photographs of awareness programs. Altogether we have taken other slides. And we have conducted a poster awareness for the public. This was the poster being made by the students and faculties. It is for the public. The content is, we are there for you. For you, with you. That's the content. We the faculties, we the Ayurvedic system is with you. That's the content. Then only the people may come to our system. It is for the enrichment of our system also. These sort of posters are very essential. If you suspect adverse drug reaction, consult your doctor. Report to the nearest pharmacovigilance center. That's the key thing. So there was an e-poster competition previous year based on this, and a faculty got the first prize. That is the picture of that. Then we have a lot of adverse drug reactions we have got, and just in a moment we have collected the data. The Spermacort, the medicine prepared by the Kottakal Ayurveda Shala, there was a severe vomiting happened to 1 or 2 cases. It is not in more numbers, but we observed these sort of things. Then we are mainly using for nausea, burning sensation in the throat, nausea, vomiting, especially during that period we noticed. Indukandam and Shatpalam, both are immune modulators, immune promoting things as far as Ayurveda is concerned. Then itching and rashes over the chest, and when we analyze the drugs, what is causing? As far as Indukandam is concerned, Pudiga Daru Desamula Kashaya Siddham, Satshira Shatpala Yudham. Then you will have to think which drug may be behind the curtain. Such sort of thing is very much essential. Then Nimbamrita Eranda capsule, mainly we are doing it for the Virejana purpose. Itching with eruptions all over the body. Yogaraja Gugulu, Sukumar Eranda capsule. And Sukumar Eranda mainly we are doing for the Virejana type of procedure. But there was no effect at all for that medicine. Then more areas, topical applications like Karuttavatta, Valiya Chinjadi Thailam, Nagaradi Churnam. So all these things are from our hospital itself. Already Galip sir told the contribution is only from the academy. So we are telling from our institutional hospital and the charitable hospital under Ayurveda Sala, where we can reach. It is from a 200-250 bed scenario. We are reaching all these things. Not from a wide angle. We are not getting such things. Then there may be a gastrointestinal problems with the medicines with the Myxopyrum serratulum, the Chaduramulla. The skin reactions, Simhanada Gugulu, The Gugulu related spectrum is some sort of issue we are experiencing some or other ways. Systemic reactions or then systemic effects, oral lymph node erection, systemic edema, all these things are being noticed by Yogadasa Gugulu and the Rheumatica capsule. The Rheumatica capsule is a patent and proprietary medicine. That's also being used by majority of the physicians. And we have got some appreciations also from our national centers. That is during the 2019 Jamnagar conference, we have got some appreciation from the center, Ministry of Ayush. And these are some ADR or AE. It's a kind of chart, maybe not fully correct. This may be noted. Karutavatta Valley already mentioned. Vanapalandu, Simhanada Gugulu, Mustadi Marma Kashayam, Dhanyamlam, that's for the Dhara purpose, Narasimha Rasayana, Triphala Gugulu, Gandharveranda Thailam, common medicine that we are using in a it is not at all the times. In certain times you got these sort of things. Then during some dhara process, after the dhara, dhanyamala dhara, maybe some itching and all those things happening. Gugulu, Chakramarda Churnam, Jadamayadi Lebam. Mainly we are getting some issues with the skin. The patient are complaining about the itching of the skin and all those things. Mainly they know they are also seeing, because integumentary system is seen to all of us externally also. That's why they are also complaining about the skin related issues. Then the oral cavity issues will be there. Gastrointestinal system will be there. Because our system is mainly focused on the Agni related spectrum. So we can analyze one by one. Mainly we are getting some issues with the skin of the patients. Then a probable causality assessment, probable maybe stands for the most number of time, possible somewhat less. Unlikely we got some related with the GERD syndrome. Then we have done some articles also for the propagation of this particular system in certain journals. It was done in 2-3 years back. Cutaneous adverse reactions on application of Nagaradi Leba, a retrospective analysis. That is by the case was taken from our college itself. Then challenges in implementing pharmacovigilance program for ASO and H drugs, a review article. Then the APTA is a journal published by the AMA. It's a common platform for all the Ayurvedic doctors in Kerala. We have done one of the articles way back, 3-4 years back itself. We have done these sort of things. Then too, we will not get any queries from any of the scholars. And then we called the AMA organizers district-wise also in Malappuram, not the whole thing. We told them that there is a center is working. Okay, sir, very good. That's a response we are getting. Nothing more than that. So, this is our duty to enrich the system in order to improve the quality. That's the mantram that you have to keep in mind. Then only this will continue. Otherwise, we will tell, I am doing this, I am practicing a science worth around 1,000 years of old, that's all. If it want to continue the process, if our system want to continue in this scenario, we need a continuous quality, a safety monitoring. For that, our support is inevitable. A voluntary support from the physicians, Ayurvedic graduates is very essential. So, keep in mind and give advices to the students, because it is in the NCISM curriculum. When you take the class on pharmacovigilance, in the second year itself, you give some data with some examples. This may happen. Taking some examples of Dravya Guna or Panchakarma or something like that. then they will get an awareness. Something is needed in the future in order to sustain here, in order to remain here positively. So it is a quality related exercise. So that must be there in the mind of students. That's why it has become a part of the curriculum, already told by Galip sir, because it is under some sort of regulatory controls. It is there in the NCISM curriculum. That's why we are sitting here, coming from the 14 colleges of Kerala. Then misleading advertisements, we are seeing number of advertisements every day, but nowadays it is reducing somewhat, I think. In Kerala also it is reducing at least to 20-30%. We are not, at one full page advertisement was there some 5 years back regarding some medicines or something like that. Now it is not seeing. Reel, nowadays it is coming as reels, madam is telling. Maybe it's there, okay. Yes, yes, we are also looking that online platform also we are checking. Yes, the support from, I am experiencing these sort of things likewise. Some examples that we already we gone, these sort of things, skin down, all those things are there. Ayurveda, most powerful sex power medicine, all those things are there, kill 99% virus. I think all of us know these sort of experiences. Lessons learned and future directions. We need collaborations, like Galip sir told, we need a common platform to communicate, at least a WhatsApp platform. What is going on in our area, in our institution? Can we improve or something like that? Collaboration with institutes, expanding PV to cover community level practitioners, that's very important. Integration with technology. Already told that this an app is going, it is there within 1 or 2 months we will get the app. Collaboration, training and technology are key to success. All these things are needed. We need collaboration, we need some sort of help each other, like things are very much essential. Then managing ADS, early detection and response, already told by the speakers. Early recognition is very important. Patient education is also very important. And a collaborative approach is also important. It is also an answer given by the AI, not with something is given to the AI and given something back, likewise. So all the things we mentioned, discussed here are known to us. Something is needed, but we need an awake, arise, awake, and stop not till we reach. Someone told some 100 years back. That's we needed for the time being. So that we are expecting from the faculties like you for the further growth of our system, for the quality improvement. We need an approach of to improve the quality altogether. So we will do some activities together for the enrichment and empowerment of our system. Thank you.
Thank you, sir. Now I invite Dr. Ramesh Envi to present the token of love.